So we're used to a specialty in dermatology that largely was been composed of 1 and 2 people practices that kind of centered around taking care of people's skin. Do you think that's likely to continue? I mean, what do you think the derm practice of the future is going to look like?
Well, I think it's always dangerous to predict the future, to try to do that, but I'm going to go ahead and do it anyhow. And I think that one of the messages I think all of us really want to make is that we're discussing things, important issues. We're trying to give people perspective on it, and we hope that the dermatologists out there will position themselves to be able to navigate the future. So I think there's going to be at least 2 major trends that we're going to see in medicine of the future. I think you're going to actually start seeing teams. We just had talked about that earlier in the discussion. So the physician will be running the team. As a patient, when you come in, you might see a nurse, a PA, nurse practitioner. When you see the physician, you know you've got something really bad, because it'll be layered like that until you get physician care, because we are the most expensive form of care. So teams are definitely in the future. They could be virtual teams. You know, you could have people in different areas that communicate through the internet and have that set up and be able to do that. So it doesn't mean that a team has to be in the same physical space or connected to each other. The other thing that I think is going to happen, and I agree with what Oliver was saying earlier about the whole electronic phenomenon, I think that we're going to see an explosion of that. I think everybody's going to have to be connected electronically. And then patients' expectations are they're going to want to have a positive web experience. So, they would like to be able to send you emails. They would like to communicate with you some way through the phone. And I think that we're going to see a lot more of that communication between dermatologists and their patients, that there'll be a to and fro. And it might actually get to the point that teledermatology will finally arrive. I think that's probably more of if you had a 3-dimensional view, I think it would be better to be able to do that. And that, I think, depends upon what type of technology advances that we see. But it's definitely going to be much more connected and much more electronic. And as everything's going mobile, your patients are going to be, using their mobile devices too.
I agree with what Pat's saying. I think the patient of the future will be the driver of innovation. Just as people like to make their airplane reservations on their phone and know exactly what it's going to cost, and they can pay for it right there, and they can make their restaurant reservations on their phone, I think they're going to want to demand that same level of service from their physicians, that we're going to have to really understand the importance of what Randy was saying earlier about that patient satisfaction. And part of that's going to change the old model of a patient calling, asking for an appointment, finding out when the next available is, and maybe that works or doesn't work. They're going to put in when they want to be seen, and it's going to be up to teams of physicians and practitioners and multi-specialty groups to make a way to meet that patient demand. And I think it's going to turn that dynamic 180 degrees.
And because of some of the complexities that we've been talking about, and because of the nature of folks that are going through training, as I see them in our program and others, I think it's much less likely they'll be in 1- and 2-person groups, because we're trained in dermatology. Many of us have other skills and abilities, but I never was trained in electronic medical records, and thank God I'm at a place where there's some expert that knows how to do that, or writing a contract with an insurance company, or all the other things, the metrics for measurement. So I think that the younger folks are going to be more comfortable working a finite amount of hours. They're going to be looking a little bit more for a little bit of work-life balance. And I think as a result of these complexities, the face of dermatology will be more either larger specialty groups or integrated groups, or being integrated in some way into a system, and continued diminution of solo or 2-person practices.
Do you think it's going to be more single specialty groups or more multi-specialty groups?
Well, I think it'll be a mixture of both.
I do want to clarify one point, though. I don't think that, I think there's a misperception that single specialty groups, smaller specialty groups, I want to make sure it's clear that it's not that they perform bad care. It's that I think they actually do a really good job. I think that there are going to be outliers, but I think really the bigger issue is the infrastructure around them. So I want to make sure that that misperception is not out there, because a lot of people interpret this whole healthcare reform and this potential attack on the private practitioner. It's really not an attack on them.